This poster is about mapping key ethical issues surrounding electroceutical treatments for depression. Psychiatric electroceutical interventions, or PEIs, are becoming increasingly prominent in the treatment of major depressive disorder in patients whose first-line treatment has failed. The purpose of these interventions is to improve cognitive, emotional, and behavioral abilities in psychiatric patients. PEIs include electroconvulsive therapy, transcranial magnetic stimulation, and deep brain stimulation. However, these modulations raise significant ethical concerns and confront ethical principles such as informed consent, autonomy, and risk to benefit ratios. We aim to develop an analytic map that displays the relationships among ethical issues, the focus of different clinical guidelines, and the differences and similarities across three different PEIs when used for major depression. We conducted a literature review in peer-reviewed articles about PEIs, specifically articles discussing ethical issues and clinical guidelines. We conducted content analysis to extract overarching themes to incorporate into an analytic map model.
On the poster are examples of the informed consent and guidelines sections from our literature review-based analytic map. We also want to make sure that it is noted that the analytic map will also cover multiple stakeholder perspectives, including psychiatrists, patients with clinical depression, and members of the general public. From the informed consent literature, the major theme that arose was patient capacity to consent, and this was found in both ECT and DBS literature. Patient capacity to consent is divided almost in half on whether the neuroethical literature believes that patients with severe depression do or do not truly have the capacity to consent. Because severe depression is a mood disorder and a mental illness, some people believe that patients with such severe depression do not really have the capacity to consent in beginning treatment or cessation of treatment. Another major theme brought up was because that PEIs have an increased riskiness associated with treatment in comparison to treatments such as psychotherapy or even pharmaceuticals. This increased riskiness means that a more involved and comprehensive informed consent process should be used to truly make sure the patient understands all of the risks that are associated with PEIs. Informed consent literature also showed that there were recommendations to improve informed consent, including making sure that there's an interdisciplinary team when using informed consent, to provide all of the information and more information specifically on risks and potential side effects associated with treatment, as well as making sure the burden of proof is on the clinician to provide all of the information to the patient and to make sure the patient truly understands all of the information that they are receiving.
The most commonly discussed themes throughout the guidelines literature are grouped together as clinical criteria for patients, simulation type or location, and the most noted adverse effects. The greatest variation in themes within these groups was found among the clinical criteria for selecting patients for these PEIs. The literature revealed that there was conflicting recommendations in when to employ these PEIs over the course of a patient's treatment.
This analytic map model on the poster is not completed. Once we finish our literature review and create that analytic map, these results will be integrated with results from our national survey and our semi-structured interviews conducted previously. We want to make sure that we encapsulate multiple stakeholder perspectives across different modalities and treatments. Overall, the analytic map model aims to anticipate ethical issues that need consideration and strategize methods to address these issues. We want to make sure that we are providing rich and diverse information to promote meaningful engagement when discussing and implementing the use of psychiatric electroceutical interventions in the treatment of depression and other mood disorders. Thank you.